my name is Jeremy Kallicum. I've worked with Ann Livingston for a very, very long time, and I'm one of the co-founders of a group called the Drug User Liberation Front. And it's my pleasure to be here today because Ann Livingston, a longtime community organizer and activist, will be receiving an honorary degree from the University of Victoria, which many of the people in this room helped with. And I'm sure many people across the world believe that Ann deserved a long, long, long time ago. So Ann Livingston has done a tremendous amount of work that nobody else, I think, could have done, or at least didn't do. The things that she's done go beyond what I can remember. There's tons of things. When I nominated Ann and I wrote up everything that she did, it took forever, and I probably got some things wrong, but but you know, so some of the things that people are most familiar with Ann's work is the co-founding of the Vancouver area network of drug users, and work before that with some health board group that was, you know, some downtown east side health group, which eventually became in, you know, somehow Ann in partnership with others, people who use drugs, started the Vancouver area networks of drug users, which is now a global kind of symbol of, you know, resistance and liberation for marginalized groups in society. It's a group that stands up and is a voice for people who never had a voice before. And through I've had the honor of working with Ann over the last, I don't know, I think 6 years. I've only been doing this work for 6 years, and for the last 3, I've been mentored by Ann, who's taught me a tremendous amount of things about organizing people who use drugs, or working with community, how to be a leader, how to when to step back, when to and when to push. And that's certainly something that Ann is incredibly good at, is pushing and and you know, making sure that things happen. So VANDU was formed years ago. Was it 20 years ago? Maybe 25 years ago, and has been doing amazing work ever since. And it has withstood the test of time, which not a lot of things have that are like this. And even since then, she's continued to work, and working with groups like the BC Yukon Association of Drug War Survivors, the Surrey Newton Unions of Drug Users, the Nanaimo Area Network of Drug Users, and even more drug user groups. We spent years working together, starting drug user groups in British Columbia, and it's tremendous work that's still continuing today. Obviously, they've taken on you know, leaderships of their own and become things of their own, but without the hand of Ann, that these groups probably wouldn't have started. And I think that's true with a lot of these things. And it takes a village, but sometimes you need someone to give it the initial push and kind of do a little bit of, you know, support, or, you know, be the one who, you know, screams and terrifies people into you know, taking action. So, you know, this work's been going on for so long, and I asked Ann before we got here, I mean, how do you want me to introduce you? And, you know, she said, she said, I'm sad. She said this work's been going on for a long time, and she said she's sad, and she's pissed off, and that it's hard to see people doing things. And, you know, if you're able to persist through that, which I know Ann's done for decades, and get things done, that's really where things happen. It's that kind of bone grinding persistence that Ann certainly has. And it's my honor to introduce Ann Livingston.
So the talk is about drug user groups actually being an effective way to change drug policy, and not much else is. So I don't know if people are going to be able to see this. Certainly the people at home, I hope, can see the slides. So, oh my God. I made it do it before, honestly. What am I? Oh, I'm really going now. Okay. So the big question then, of course, is when I sit back and look, why is it that we can't get drug policy changed? And, you know, who's the most effective thing? And my hypothesis is that it's drug user groups who do the work because they have the most to lose and they're more immediate to the problem. So the theme that I'm looking at is civil disobedience, a way to ensure healthcare for people who use drugs. And then this is just a basic thing about civil disobedience. When I looked into this, many medical advances have been done with civil disobedience all around the world, not just in Canada. But when citizens break the law and act to save lives of their neighbors and friends who are who use criminalized drugs, it's because an obvious fundamental injustice is occurring. And well-researched life-saving health initiatives such as safe supply of tested drugs and overdose prevention sites are being withheld from people who are damaged or die as a result. And we certainly all are very aware of the huge numbers of deaths, and they've increased. A Canadian example of healthcare as civil disobedience includes Dr. Morgenthaler performing abortions and ensuring the law against terminating a pregnancy changed by going to court. And he went to court many times. And I used to veer away from this thinking, oh God, murdering fetuses, you can't compare it to that. But I now think that drug users are actually hated more than people who perform abortions, just saying. And women were dying from incompetent abortion. So this is the reasoning he used, and I'm encouraging all of us to keep this reasoning in mind. Women were determined to get abortions in spite of the danger to their health. To prevent unnecessary deaths, he used civil disobedience to change the law. And his defense in court is really interesting if you follow that whole movement and how the legal thing moved through, because we might as well use the courts along with everything else. Defense of necessity. He felt that when someone came to him and needed terminate a pregnancy, his duty to safeguard the health of the women who came to him outweighed his duty to obey the law. And abortion was finally, and it proved to be correct. And first he was found guilty. I mean, at one point he went to jail for 18 months, just saying it didn't work the first time. But the defense of necessity was what kept him out of continuing to be prosecuted. So the jury would find him not guilty, even though he had openly performed the termination. And so abortion was finally removed from the criminal code in 1988 as violating Section 7 of the Canadian Charter of Rights and Freedoms, and Section 7, security of the person. So, yeah, so I go into that later because I'm not great on these sections, but I just think it's a really important, when we're in a resistance movement for liberation, we need to look at other ones that have succeeded. I suggest that our movement can be unified around removing drugs from the Criminal Code of Canada. And if we don't get down to that basic, we're always going to be looking at these little reforms and nibbling at the edges and being a kinder. Our movement moves incremental steps of policy change as it should, and as for the reproductive rights movement did as well. So people could certainly get abortions long before 1988, but they had these, bureaucratic, you had to go before 3 doctors and they would determine whether you were worthy of an abortion. And if you didn't get it, you had to be a parent. So anyway, each one of those things that came in, they challenged them in court. So I just kept pushing and pushing. The move to have drugs in the criminal code and all drugs legalized and regulated will stop the slaughter that we're facing right now. The regulation of alcohol has made this clear, and the regulation of cannabis has taught us how not to regulate and legalize. So we've got, freshly coming out of that, we should be enthused that we've learned a lot from the regulation and legalization of marijuana, or cannabis, call it. Why has no one in Canada been arrested for running unsanctioned or illegal overdose prevention sites, which I've done at least 8 times? And why have the Drug User Liberation Front activists giving out tested heroin, cocaine, and crystal meth not been arrested? And my hypothesis is they don't want us in court, and they know full well that we'll win in court, because when you present the evidence, defense of necessity, that you're saving lives in spite of breaking a law, this is a very good, it sets precedent. And so I just go into this history thing. The first injection sites were done in, that I could find, were done in St. Paul's Church in Rotterdam. And a priest, or I think it was a Catholic church, I don't know. No, he's a reverend. Anyway, he was finding dead bodies outside the door. He was seeing people pulling dirty water into their, they were injecting very unsafely outside. So he just said, come in. And I believe they even used the sanctuary of the church. The facility, then you see it build, you see the influence of the drug users talking about harm reduction. So they had house dealers for social, what you call a house dealer within the church, no violence, no threats of violence, and good quality drugs, so that you're not having, this is the next step, obviously. And so it took 30 years before the police came to Rotterdam and told the director, the prosecutor's office told him that they couldn't accept the dealing in his church, and they were imprisoned. So I don't know, I haven't kept up on Rotterdam since 2003, but that's when you get another government in, and we all need to be prepared. And we see this now in Vancouver and all across the country with this hysterical safe supplies killing children narrative. There has also been complaints from neighboring householders, which is also something else that you're really responsible for that. They said they were tired of, this comes from a paper, by the way, if anyone knows Andrea Efimathu Mordaunt, Junkies in the House of the Lord was her master's thesis, and she's a drug user in London. And she's, anyway, she got a degree with this paper she had written, so I read it, and that was what was in there. The other example was that the nuns who run St. Vincent Hospital in Sydney, Australia, in 1999, they were properly set up, but the rules in a hospital are way different. And then the Pope called the nuns and said, and they said, the quote was, "The sisters later withdrew upon advice from the Vatican." So, because the church is very anti-drug. I mean, I could give you a lecture on that. But anyway, evidently drinking, the guy said to me, "Because drugs impair you." And I said, "So drinking's okay?" And he said, "Yes." And I said, "So your first glass of wine's okay, but your second glass of wine is a sin because you get that little buzz on, right?" Anyway, it's ridiculous. But so the Wayside Chapel, King's Cross, which is another church, the Uniting Church, they were then operating illegally, and they took the entire, as far as I know, they took the study over to this place, and Sydney, of course, did win. This kind of resistance really works. I'm just saying. So the Sydney has a government sanctioned injection site operating since 2001. So they were brilliant. That when we were running one of our illegal sites, they sent me a little email and they said, "Keep your eyes on the people whose lives you're saving and watch your backs." I was like, I loved it. I mean, he took the time to send us a message. Anyway, the first handing out of needles in Vancouver in 1989 to prevent HIV was an act of civil disobedience. And this is from the New York Times, 1990. So John Turvey began handing out needles on the street, and he said, and it would have been illegal, just go out and do it responsibly, of course, but I just do it. And then I find support gathering around. In other words, he was risking arrest. And he's a former user, and he's passed away a long time ago. He had some other illness. It was easier for them to vote approval for something already underway. And what's interesting, it was a very right-wing mayor, Gordon Campbell, and the city of Vancouver funded the first needle exchange. So these jurisdictional battles are always really interesting to watch. And I'm always trying to warn people, we've actually gotten more out of right-wing governments than our so-called left-leaning NDP. So that's a very unfortunate problem we have. Anyway, then they just funded it for a year. And of course, it's healthcare. So the province and the feds immediately had to pay for it, and they did. So, and that's one of the oldest needle exchanges in North America was set up in Vancouver. So John Turvey was recognized for his work, and he got the Order of BC in 2004, and he died in 2005. But anyway, I was on his board at one point, so I know him and met him, and I lived nearby the needle exchange. In the 1990s in British Columbia, there was a massive increase in the number of illicit drug overdose deaths. So in '88, there were 35 drug deaths in the whole province in a year. And in 1994 to 2000, they were coming to or exceeding about 350 a year. So, and this, you guys, I don't know if, can anyone in this room see this? You can? Holy crow, good, okay. I didn't know I thought I was speaking blind here. So the peak, this goes from 1987 up to to, sorry, thank you, just to 2002. And that peak, that big peak, that's the year I moved to the downtown east side, 1993. And the rate per 100,000 was only exceeded again from that high rate in 2016. And that's the year we got the public health emergency declared. So it was really, when people say there was some overdoses happening, it was really, really noticeable. I live next door I live in Four Sisters Housing Co-op next door to a fire place. So I just heard sirens, sirens, sirens. And I naively thought that what we could do was just call the social service people and call the health department. I was just figured, I make a few phone calls, they'd all connect with each other and we could get on top of this stuff, Anyway, I'm still not getting on top of this stuff, but I'm just saying that, so we organized drug user groups, and the first drug user group that we did was actually done by Innovative Empowerment Society. And I'm pretty sure they were all communists or something, anarchists, but it was really good. And there was tons of us, we were all on welfare. I had little kids at the time, and we did a bunch of meetings, but one of the meetings we did was to set up meetings in the downtown east side of Vancouver in 1995. And then the reason we did that was to give voice to, anyone who's doing drug user organizing, you could say, well, I know the more elite privileged drug users, they're easier to organize. The problem with that is most of them have to hide their drug use in order to succeed in life. You know what I mean? The stigma is unbelievable. But so we were saying, give a voice to the people who are the most vulnerable to harassment from police, neglect from healthcare, to incarceration, to apprehensions of their children, to hatred from society, and to illness, meaning all those bloodborne pathogens, and to overdose death. So this was the first guerrilla site we had. And it was called the Back Alley, which was nuts because you couldn't get in from the back alley, but it was open 3 o'clock in the afternoon to 3 o'clock at night. We had 3 grants of $8,000 each. And I put it in my name, and it was $650 a month. And by the end of it, we were paying $950 because they kept contacting the owner, and he said he was okay as long as he kept jacking the rent on us. But anyway, we were there for about 2 years, and it was all run by volunteers. So, and at first, oh, no one can use drugs in here. This is our clubhouse. And then people were getting pepper sprayed in the face, and it was a very difficult and high overdose time. So people said, no, I think they should come in here. But that's one of the great lessons I learned about drug user organizing is don't go ahead of them. If you're in a meeting, I'm facilitating the meeting. I make sure I've got $5 to give everyone, or it was $3, or I don't even know what it was, something tiny. And then wait until they come to that conclusion and want to do it that way before I go, we're doing it this way. So that's, they're democratic and grassroots. And it's one of the real skills of being an organizer is that you don't get too far ahead of your, you can't be more radical than your group. You can be, but good luck. I'm just, so and you want to just keep it quiet. You can predict what might happen next. Anyway, VANDU finally formed in 1998. We got money from the what's called the Vancouver Richmond Health Board in those days, and our first grant was to reduce hospitalizations, and it was a tiny grant, and we got a little horrible office for $400 a month, but the roof leaked. And anyway, that's a picture of there was no chairs, and we were in Lookout in this upstairs area above the living room, the old living room. It's all torn down now, in case you've not been to Vancouver for a while. But anyway, they're all sitting on blankets, and they had never had anyone ask them anything about what they thought was the way to go forward. So we became very popular very, very quickly. And we held 100 meetings on 100 Saturdays. We didn't care if it fell on Christmas Day. You got to keep the same thing, and everyone got, so they knew when it was on. And anyway, they were well attended. Anyway, so the mission of VANDU is to improve the lives of people who use illicit drugs through user-based peer support and education. I think currently these are the right numbers, 2,500 voting members who are users and former users of illegal drugs. VANDU spawned the BC Association of People on Methadone, which has their own nonprofit. So one of the signs that evidently the super organizers told me is a good sign when you spawn other groups, because they become the people on methadone, the people who are smoking crack. Someone on methadone goes, my doctor took me he reduced my dose by 15 mils, and they know this is going to take a while. They're all going, oh God. So we made the the methadone group right away, but they're called now people on opiate maintenance. The Western Aboriginal Harm Reduction Society is Indigenous people who use drugs because they face such a different kind of bunch of problems. So they're all done as sort of caucuses or committees. Like I said, we're forming an Aboriginal committee, and they said, we don't form committees, we form councils. I was like, okay. But anyway, they wanted it to say the word wars. EDGE is a drinkers group because the drinkers started going, oh yeah, so you guys can get like heroin prescription and methadone. We can't get anything. So then these drinking programs are the idea of the drinking programs, and their right to have alcohol on a maintenance basis was they pressured us, and we just went, well, yeah, we're not kicking. We used to have these big debates, we're going to kick out all the drinkers. They're not really drug users. And the whole room would, popping off, and everyone's speaking on the mic, and yes, and then finally they go, we can't do to them what's been done to us. We need to stick up for them. And a lot of them, use other drugs as well. But anyway, SNAP was this Salome Naomi Association of Patients, which was people who survived the studies of heroin who were promptly abandoned. Thanks for being a subject of our study. Now you get methadone, and you had to prove you'd failed at methadone twice. So they fought for the methadone to actually become a program. And without them, I don't think it would have happened. So, we were kind of miffed that our lawyer didn't take the case, and it was St. Paul's or Providence Healthcare's lawyer. And I thought, victory is that Providence Healthcare is going to take the government to court so they can continue on with their heroin study. That's nothing to be sneezed at, but it was kind of offensive. We want to do our own lawsuit. Anyway, and BC Yukon Association of Drug War Survivors is less active than it was, but it was meant to be a network of drug user groups all across the province that would really intensify the ability to have a consistent voice across the province. So this is VANDU's famous for implementing unsanctioned community user-run initiatives to save lives. So the first thing that we did that was controversial, believe it or not, was to give out needles at the corner of Main and Hastings. And they had a very strict, you're going to see a pattern here, that civil disobedience, believe it or not, that was civil disobedience. So the police came and gave us a ticket for blocking pedestrian traffic, but we had done so much research, we knew that people couldn't get needles, with a VITUS study, we were getting that data. So that's a really good thing for drug user groups to work with the researchers. So you're the smartest drug users. And when, so we knew what time to set up. They couldn't get rigs because the needle exchange had closed down. Plus they had a very strict 1-for-1 exchange with 2 loners, this one. Oh God. It's a perfect way to spread AIDS, and AIDS was a real issue. We had a huge outbreak of AIDS in the downtown east side. So anyway, this is the coverage. Vancouver police raid needle exchange run by drug users. The police claimed that drug trafficking was going on at the needle exchange run by VANDU, but they failed to provide any evidence to that effect. The police later apologized for their remarks, and the exchange reopened. And the reason they apologized is because we got a nice letterhead because Pivot had formed. I'm a co-founder of Pivot, and we sent them a letter saying that we would be seeking further legal action unless they apologized. I wish I had a copy of that letter. I'm sure it's the only letter to a drug user group that's an apology, just saying. So VANDU's action, and that's good. If you push back, they'll be like, ooh, they don't like that kind of publicity. So the success of that and the whole hypothesis of this talk is that you can change drug policy. So policy changed from needle exchange to needle distribution and collection, because we looked at the VITUS data and we knew that lack of rigs was fueling both HIV and hepatitis. And then we began distributing outside at night. And the very first thing where I'm showing you that, the very, very first needle exchange, the control issues that they had, they'd pull up in a van and they do 1-for-1 exchange. And then all the users using the little injection, they wouldn't give us needles. So we finally just started buying them. And then the nurses started giving us boxes and boxes of needles, which I kept at my house because they would just all be stolen. You could sell needles. You go anywhere and you can sell a needle. There's not enough needles out there. And particularly they could sell used needles, or people were repackaging. Like, it was just frightening. And anyway, so it was a very important thing that we did. The needle exchange was really pissed at us because they had rig limits, and the Vancouver police gave us the bylaw. I already said that. We just persisted. And then the research, they published the paper. And this is that, you know, you do the civil disobedience, you know, everyone hates drug users, so they think you're terrible. And then you've got, you're working with a researcher, you get all the media coverage, and then you publish the paper in a peer-reviewed journal. This is to me the magic combination, although we don't always get it. So the next place we opened was 213 Dunlevy. We didn't get any studies on this one. I think there was one, but it was Gordon Row. And the main thing about this one, you'll see it in the movie Fix, if you've ever seen it. That's where we're operating. And again, no money. We were really careful not to use any of VANDU's money to rent the place, because when you sign those contracts, everyone here in the room, anyone here a service provider who has to sign contracts, you don't want to get in trouble. So anyway, we muddled it along and it worked. So the next one we opened was at 327 Carroll Street, and this is just off Pigeon Square. It's now a pizza something, and it's all modern, brand new, totally gentrified, just saying. But I swear it had the oldest toilet in Vancouver because it was hell to deal with. The government approved, they then said they would do the injection site, and we got approval, and then it's delay. And they added 50 police. Somehow we found out. So we just went and started doing the injection site here, which was unsanctioned. And then this is the coverage. Militants opened safe injection site 3 weeks ago. Mayor, police chief at odds over what to do. So the mayor was Larry Campbell, and he had been the coroner, and he was a great coroner for us all during the 90s when we were doing anything about overdose. I'd go, oh, don't believe me. Call Larry Campbell, he'll tell you. And he would always say that every one of these deaths is preventable. And he came and he would talk to our groups and stuff too. So anyway, and then the Chief Graham, I think you guys got Chief Graham here after we were done with him. And his words can't describe how disappointed we are that these groups have taken this action. I think you live a long time to hear a statement like that from a police officer. And so so that was the thing. So now there's the published studies. So harm reduction activism, a case of an unsanctioned user-run injection site. And this was published in Canadian HIV/AIDS Policy Law Review. And then another one was published in the Journal of Urban Health. And then the volunteer nurse who showed up also had she won an award, Megan Olison. Anyway, so Insight finally opened in 2003. So this is what you're heading for, right? So, but Insight prohibited assisted injections, and we failed to negotiate assisted injections for people with disabilities at Insight. So, like we were onto them. Like, it was weird to have it open and be threatening to protest in front of the place that we'd worked so hard to get open. But, you know, it's uncomfortable work. So they don't have toilets is my big complaint, but and they may have them now, but I have a hunch. They, like the one in Nanaimo, they opened, no toilets. I'm going, no toilets, okay. Anyway, we launched a legal challenge to Canada's Controlled Drugs and Substances Act. And what happened was that they put our lawsuit together with Portland Hotel Society's lawsuit, and this is all the Insight case. And it's an interesting precedent as well. That's something all of us should know when we do this work. And VANDU's was just dropped because we were challenging the drug laws. No one will talk about that. But they said PHS must be granted an exemption 56 from the Controlled Drugs and Substances Act. And that was a Supreme Court of Canada ruling. And the famous Dean Wilson is here. You have to have a person. They had 2 people, and he was the plaintiff, I think they call it. So Portland Host tells, this is the case. We took the matter to court and argued that drug users have a constitutional right to health and harm reduction services. And the court found that the laws prohibiting possession and trafficking of drugs are unconstitutional because they prohibit the management of addiction. They treat all drugs and all drug users the same. They contribute to harm, and they do not contribute to individual and community health and disease prevention. And here's the quote here that makes it the most clear in a layman's terms is, well, these are not prohibited substances. And he's talking about, you know, overeating, smoking cigarettes, and drinking too much, right? You can ruin your health in this way. And So it says, neither condemns the individual who chose to drink or smoke to excess, nor deprives that individual of a range of healthcare services. Management of the harm in those cases is accepted as a community responsibility. I cannot see any rational or logical reason why the approach should be different when dealing with narcotics. So that's a really, you know what I mean? I don't know. I found that like, okay, I get it now. So you can ruin your health with all kinds of things and still get health care, but you can't. And what drug users were experiencing by not being able to have an OPS or an injection site was a health service that was meant for them. And to deny them that would be not consistent with, anyway. So it was a huge victory. But it took 5 years. And of course, they were open the whole time, just saying that you get a court and order to remain open until the case is heard, blah, blah, blah. No other supervised consumption rooms opened in Canada until we opened a tent in an alley in response to the fentanyl overdoses in 2016. So I'll come to that later. In 2005, in response to not being able to get assisted injection at Insight, we started to talk to people. And I noticed that other people come up and go, a woman's talking to a man, she goes, I'll pay you. And I'm thinking, what's she going to pay him for? And it's giving some drugs to that person because he's a HIT doctor and he's going to help her inject. Do you understand this? Okay. So we found out that there were HIT doctors around and we organized them into a team and to help with unsafe and assisted injecting, as well as the prohibition that they couldn't do the assisted injections at Insight. So the injection support team was a community-based research project during Stephen Harper's reign. I always used to tickle me. They get $200,000 a year. They snuck it out of the federal government and he didn't even notice. Anyway, so they published a paper. It was Tommy and Will Small, Evan Wood, you know some of these people. Anyway, so that's the published paper in, I can't see what it is, but it's peer reviewed. So that's great. Then injections and drug smoking at VANDU. And it came up during the injection support team. They sort of wander around looking for people who needed help injecting. And then I started thinking, well, you can bring them back here. And we didn't have, I had an office and I said, you can just use my office. Boy, welfare days, you couldn't tell who was on the team and who was the people they were helping. There's blood sprayed up the walls. I was like, okay, I think we might need to make an actual place. You know what I mean? I don't want to come in here and, you know, it's just normal. So in order to prevent deaths in the VANDU building and to reduce public drug use around our facility, we launched the peer-run sanctioned safer injection room and safe smoking guidelines for the bathroom, because the bathroom was the only room that had a vent in it. And then it worked for years. And no, we never announced it, but they had about 150 to 100 injections a day. And of course, a lot of that was from the people that needed assisted injection. You understand? So then we get who's this guy? Ryan McNeil, now teaches at Yale Medical School or something. Give people a step up. Anyway, he did an ethnographic study of assisted injection. And of course, it's a really interesting study. I mean, you know, it's going to be women who need more help than men. And you know what I mean? Some of the stuff you'd think. So, and then another paper got published. And these are really helpful. You know what I mean? It's like, you get to be heroes. You get to be considered best practice because you got a paper. It's still a problem now. We're trying to make sure we always have researchers or someone to do the data for us. So oddly, in 2014, I think it was because they were trying to get the thing for Insight and the cops said, if you don't go shut down VANDU's injection room, we're not going to sign off, because they used to still have to get a sign off from the police. Anyway, they came, by this time, the Vancouver Coastal Health Authority people came, and we were just freaked out. So within 20, and this is from the media, within 24 hours, there was an exponential increase in drug-related debris in the alleyway and everything. We just felt terrible abandoning these people that needed assistance with injection. And so this is more from the media. It must have been the Sun. I didn't think to write it down. 15,000 injections a day in the downtown east side. 600 of those happen at Insight. And then of course, we did see Insight continuously extend their hours, but it's really, you know, we just felt like people wouldn't even walk 2 blocks up to Insight. But if you wanted to know, and I think he says that in the papers, Well, if there's somebody you owe money to or someone who's violent towards you, or you're not feeling safe, you won't even leave the block you're on. So if they're on our block, they're going to stay on our block and they'll use their drugs on our block. So they might as well use them in our injection room. So then we said, I had this van that I had access to. So we opened a van in the back. But even then, we were ordered to shut down the van. They said, well, you know, that electrical cord was, we opened it in December. Do you know it's dark at 4 o'clock and you can't see? I was like, when it's freezing. So we had to have electricity. And they said, you'll lose all your funding. It was just a threat. And, you know, VANDU could have said, yeah, it's worth it. We'll lose our funding, but they didn't think it was worth it. And then it became assisted injections took place at VANDU by appointment. So people were still kind of being served. It just pushed us further underground. But look how close that was to 2016 when they came begging us to please reopen your room as fast as you can. I don't know. I'm glad I wasn't there because I was pissed. Anyway, this was, it was very difficult to run this, but it's just showing you just need some shitty van and just say you're doing it and start doing it and people will come. And you know what I mean? You get that sense of resistance, as it were. Public health emergency was formally declared by Kendall in April of 2016. I just want to say, you know, we've got the only public health emergency declared in the world. I went to Glasgow to a conference last October, and we're lucky to have that. It means we should go to town with law cases, because I think that the government, once they declare a public health emergency, they have this massive amount of power, as we all saw during COVID, and they can make ministerial order after ministerial order after ministerial order. And they were refusing to do this with people who use drugs. And we need to get an angle in on it and sue the hell out of somebody. So anyway, the response was pathetic. I started phoning people and saying, oh, the public health emergency is on. When are you opening your OPS? They said, well, we were waiting. It'll be another year before we get our exemption from the federal government. I just thought I was going to fucking blow my gasket. Anyway, as usual. So the federal government lost the in-site case. And what they had done is they made the requirements for opening an injection site just daunting. You know, it was like 14 pages, you know what I mean? So that was their revenge. Yeah, we lost and you won. And yes, people can have injection sites, but look at these new millions of regulations we've set up. So, so we just opened a tent in an alley, and we were open from 10 in the morning to 10 at night. And I was out at this, I was working in a kind of street market. So I was out all day, often 10, 12 hours. I mean, I kept coming and going, picking up kids and like doing whatever. But anyway, so we've just recruited the people who came to the facility. And this was we made up the name Overdose Prevention Site. And we had another longer name, but anyway, so here's the media coverage. Vancouver Coastal South says they do not support or condone it, noting that it's not legal. The city of Vancouver has washed its hands of it as well. The back alley facility saying it's not connected nor sanctioned by the city. Everyone just couldn't, it was like, fuck you. I mean, we were like busy. I mean, swamped. The people were leaning across tables. Tables were completely filled. Our rule was, there's Chris, she was there. If our rule was no waiting. So we just set up another table in another tent. And if there's something you have at a street market, it's lots of tents and lots of tables. And we didn't want people in the alley. And they just, I can't describe it. It was packed all the time. Someone's doing an assisted injection and someone else's, and it's all smoking, and because the tents allow for smoking, right? So it was a unique situation. Anyway, fine line between harm reduction and enabling addiction. That's what we were accused of. But I love the last one. It says more harm reduction sites like Vancouver Coastal Health Insight and addiction treatment clinics like the Provincial Health Care's Crosstown Clinic, which is heroin prescription. So they hate our fucking guts, right? It's the Sun editorial, but they support heroin prescription. And I thought only Vancouver. This is brilliant. So I got a real kick out of this, but we had horns. They hated our guts. Anyway, this was a spike. If you just see, and it only goes up to 2016, just in case anyone is curious about how you could ever say it goes along and goes along and goes on. And I know you guys know this, it's happened everywhere and it's gotten worse and worse. But that was so there's the cops rolling up, and there's Chris. She's in the back there. we're sick because you always have this, are you going to let the police in? You know what I mean? Like just saying. So we're going, oh no, we're good, like whatever. And just someone had complained, they bought a condo up behind it as Chris and I always go, how much did you pay for that condo? It's not the cheapest condo in Vancouver, and you're going to complain because there's drug users in the neighborhood. Whoa. Anyway, so this is when Terry Lake came, and he was, I woke up yesterday at 4 o'clock in the morning and was thinking about that pop-up tent. And the real challenge that we see in cold weather, people have a combination of overdosing and hypothermia. So I knew we had to do more, so that he writes this ministerial order. So sites opening do not have to have exemptions from the Controlled Drugs and Substances Act that were previously required to open. Of course, we didn't have one, and none of the places I've ever opened have one. And, you know, I know people get them, and that's part of, you know, service provision, just go for it. I'm assured that we're not contravening federal law under the Emergency Health Services Act. I can make this kind of order for in the face of a public health emergency. And that's key, because we are not going after Adrian Dix, and we need to really make a focused campaign. I need people who know how to make really well, we don't have to mean first. We can just start pointing out that he has 12,000 people's blood on his hands. He's not made one ministerial order on this. He's done absolutely nothing. And people often think it's Bonnie Henry, but it isn't. It's done between the medical health officer and the Minister of Health, which means Whiteside, the Minister of Mental Health and Addictions, cannot make this kind of order, as far as Perry Kendall speaking to me. So here's a copy of the order. Anyway, I had the city of Nanaimo point out to me that this order didn't cover our illegal OPS, and that we had a letter from the medical health officer there because a motion had not been made at Vancouver Island Health Authority. And I thought, why didn't I record this conversation? And we were shutting down already by then, so I didn't get a chance. That's what it looked like inside the tent. And then, so the what is a disaster is we've got this sort of higher level buy-in from the Minister of Health with this ministerial order that's, you know, it's still in effect. And then I'm saying here, despite public health emergency and the ministerial order from the Minister of Health, Terry Lake, people who use drugs in each municipality have to deal with harassment and blocking of government-funded OPSs and illegal one, like whatever you do. And even the police often get involved. Many communities have no overdose prevention sites, despite announcements by the Minister of Mental Health and Addictions of funding for local health authorities, who then award the contract. So it goes to a BC bids. And in the example that I'm really upset about is in Newton, Rain City got a contract and for 3 years has not opened. So worse, drug user groups are harassed by bylaws when they lease a space to operate. But, you know, drug user offices are full of people who use drugs continuously. So this is the van that's parked at Rain City at Foxglove, and it's been ready, sitting, and never, ever been used. And no one will tell me who says they can't just go and set it up. So Rain City could grow a set, but you know, they have huge funding and they don't want to get in trouble. That's fine. But if my kid died in Newton, I'd be it'd be a court case, just saying. But what's happened is it won't. So they was supposed to be a community health center model, which at least means you can get warm, take a shit, charge your phone, that kind of thing. And then they moved to this mobile because they're thinking, well, they're so resistant here. Why don't we do the mobile? And guess what? They're still resistant. It doesn't make any difference. So I kind of say, don't give in to any of this. Stand your ground, do the first thing that you were funded for. But anyway, it's so this is a little bit of a story just to illustrate what I'm talking about. You can get this high level, you know, oh yes, we're funding all these OPSs. There's 41 across the province, you know, we're the most, like, I don't know if you ever hear them talk. It's absolutely frightening. So the Nanaimo Area Network of Drug Users got a grant of $80,000 from CAI, and we leased a space and the tent was meant to hold meetings, but it quickly and quietly became a safe place for NANDU members to smoke drugs, and there was no OPS for smoking in Nanaimo at the time. This is right in the midst of COVID as well, which was a hell thing. So NANDU began operating an OPS due to necessity, and we had no paid workers. the NANDU volunteers, if you came on the site, you could come to the volunteer meeting and get yourself a shift, but it was really, I don't know what you call it, immediate, and sort of wild. I don't know. Anyway, they were open 7 days a week, 12 hours a day. And NANDU closed when the real OPS, which is funded and the funding contract went to the Canadian Mental Health Association Mid-Island branch. And their current funding model for OPS chases the very users who need the OPS the most away with arbitrary rules. So we're seeing it. And if I had been able to document what happened in there with a nice student or something, we learned that social networks and substance use navigation make OPSs effective and welcoming. And that's probably the main function that we observed. And that means they'll sit around and talk to each other and network with each other, and people will come sometimes not to use, but to score because they rely on that substance use navigator. Everyone knows what that means. That's a dealer. If you don't know that word, that's what it's called. They call themselves SUNS. Yeah, SUNS, substance use navigators. Anyway, so and then this other dilemma that we face all the time is when you go from a grassroots movement to a harm reduction industry. So if you picture it from the drug user's point of view, harm reduction's evolution from a grassroots movement to an industry can be seen as welcome progression because it's a long-term goal was to reform public health system to make more evidence-based, so we fight for the government to protect the health of people who use drugs. And then during the evolution, however, many of the critical components that define harm reduction get sidelined, like social networking and substance use navigation. And then I didn't write this, Johnny Zabel wrote this. Anyway, one of these is the way people who use drugs are reduced to program participants, clients, or patients, not people with the skills to help create, design, and deliver harm reduction services, which they just did as civil disobedience. They run all these things, and then when it goes to the service provider, now they're just a client who's meant to obey the rules. When they made the whole, it was their genius that got it going. So this is partly because, well, I didn't go into this, but people who use drugs are seen as caricatures of chaotic, dysfunctional junkie, as he says, due to stigma. And anyway, so I just put that in there because one of the discouraging things is we work so hard to get these things implemented. And then we have this moment where we go, oh, I don't know if we should have done that. Like, what fresh hell is this? As Garth would say, Garth Mullins. So this is what was interesting in Nanaimo was that city councilors respond to the most hysterical, unkind citizens as if they represent their constituency, which isn't true, but they don't. They're just panicked. In an atmosphere of hatred, drug users and homeless citizens both, supportive service providers and politicians are loath to put their heads above the parapet. So no one would stick up for us. Like you'd think that, another harm reduction group would say, well, NANDU's doing a good job. Let's partner with them. They said that never. And it was like the stinker stain of NANDU would get on them. And this is the kind of social media that Chris was following the social media and did a screenshot. Go back to the streets of Vancouver and stop messing with Nanaimo. You were all losers and you do drugs when you were whatever, blah, 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 on and on. Like you deserve to die kind of stuff. And then the real other thing that was so weird there was I immediately applied for a permit in Nanaimo and they wouldn't give us one. And they kept saying, you can't have tents. I said, it's COVID. The whole fucking town's got tents and no one's doing anything about it. Well, they said, we respond to complaints. Well, the contradiction is, and this happened in Surrey as well, because we got a permit removal there. The police and bylaw came to my house and others in the area the other day about this place and how it's changed the area. I was very blunt. So this is bylaw officers recruiting complaints. And on worse than that, they tell them if they keep calling and calling and calling City Hall and filing even more complaints and getting more and more people involved in filing complaints, and there may not even be, they said, oh, it's noise. And I said, it's the fucking Trans-Canada Highway. Like, we're zoned for this. I carefully made sure that our lot was okay to use for the purpose we were using it for. Anyway, those are tough things because you can't really get them into court. And because we didn't stay long enough, we ran out of money. the harm reduction, anyway, they're ordered to open by the Minister of Health in a public health emergency. And then the City Hall thinks that they can just shut you down. This is, I think, shocking, and I think it's illegal, and so does Pivot. So municipalities have gotten even more hateful and death causing with recently, as we all know, with new illegal bylaws. So Campbell River adopted 2 bylaws. They've since rescinded a couple of them because Pivot filed against them. But now Nanaimo is looking at putting in a no drug use in public bylaw, and you can get a fine for it. So we'll see. They haven't done it yet, but they're researching it. It's gone to staff. Anyway, as I think, what does she say? Did I quoting her? I don't think they can do it. That's from our island, our SOLID got it together, and we had it was a long time ago, 2019. We had a big conference. So this is a big synopsis. I don't even know if I should go into it as much, but it's a basic understanding about what we're facing isn't just getting services for a group of people that are disabled and hurting and obviously being harmed. If we are to overcome the current oppressive drug regime and realize liberation for drug users, we need organizations of people who use drugs that are grassroots, democratic, relevant, and effective. And we can't leave it up to service providers to do this work. They're in a contradiction. They need not to lay off their staff who have mortgages to pay because they made a political blunder and lost all the funding. So it's an awkward situation. Drug user groups need to be open to people, including the most marginalized and vulnerable. They need to be transparent so people know exactly how they can get involved as a member, what their rights are as a member, and how to get involved in getting into leadership positions. And the very obvious democratic elections are held. You should see the AGMs. I mean, most people have AGMs for their nonprofit societies, but they don't have 100 people in the room, just saying. And that's a kind of a robust kind of, and it's interesting to watch because it's, oh my God, I think we're the only ones who do it. I really can't see this. Anyway, so the other thing is that they become action. That if there's non-drug users hired in a drug user organization, it's made very clear that the board is all drug users and they dictate that person. They'll hire and fire them. So it's not being taken over by non-users. And it can be a real problem so you don't even get a vote unless you're a user or former user of criminalized drugs. Anyway, that they take action, that they don't ask permission, don't ever ask permission. Like if you're going to do something, I mean, yeah, don't ask permission. They'll say no. And then they'll tell you they said no. When you just do it, then they have to kind of deal with you. What's my famous quote? It might be illegal to run an injection site, but I'm pretty sure it's illegal to leave people in the alley and let them die. So I'm pretty sure that's illegal, but I'm not sure what law that is. Invite people to join with membership and belonging. Belonging is a huge deal. If someone walked onto this is where we're at we feel really critical of the new OPS in Nanaimo, because when you walk into there, you're a client and they're going to tell you the rules and you can't pass drugs and you can't whatever it is. Anyway, when you came into the Nandu site, people just kind of all slid over and did whatever, and it was very social. But people were aware that, do you want to be a volunteer? Like, who invites you to be a volunteer the first time you show up somewhere? Like, or not the first, but you know what I mean? Whatever. Maybe it is the first time. Anyway, the other thing is listening for the language and wisdom. Most places have very, very local kind of cultures of their drug users. And then the other thing is to be scientific about your organizing. Make sure that you're taking notes on what people are saying, because you'll have your own bias. Like, it's the fucking emergency room. Let's go after the Nanaimo Regional Hospital. Well, it may be or may not be, but you're going to have to see how many people say that and then start feeding back to them and then do the research. Is there a board of directors at the Nanaimo Regional Hospital? Who knows? Who are we going to approach about the stuff that's coming up that we need fixed? And, to be a outraged citizen stuff. So, and then the model I use for organizing, I don't know any other way to do it. You get the issues from the people and you keep getting them, and then you categorize them, then you analyze them in the sense that, you know, you're not going to take a complaint about the police to the MLA. It's just not going to make any sense. You're going to have to probably take it to the city. Although I'm telling you, who can figure out who's running the police? It's what's his name? Farnworth. Oh my God. Every time they do a cabinet shuffle, you notice Farnworth stays where he is. Dick stays where he is. I swear to God, they have more power than EB does. And that EB's put up there as a puppet, so those guys can, anyway, I'm a little paranoid, but I'm pretty sure it's true. So we also always have that sense, you know, when you go to a 12-step meeting, you'll often read the mission of the group. There's nothing wrong with doing that, because people are going, oh yeah, my friend told me I'd get $10 if I came to this meeting, or, you know, like focus the people, make sure you're doing a good job of facilitating so they know why they're there. And you can torture them for $10, make them watch a PowerPoint, just saying. It's not usually torture, because you can see people are sitting there all cynical and hunched over, and then you can start seeing them going, oh, this is fascinating. Oh, I didn't know that. Like, you know what I mean? That it really is for real. And then each new member is welcome. There's always room for one more member, no matter how shitty your budget is. And then remember that everything accomplished can be wiped out in a flash, except the enduring friendships, hope and sorrow and pride of resisting the unendurable. And we've certainly experienced this at different times. And that's why it's good. They know my home number. You know, some whole group will shut down, but people still know how to get in touch with each other. So networking is really the key to success over a long period of time. Develop leadership by ensuring organizers, that the non-paid, or I mean, the paid workers have to be really careful that they don't start to just dictate how the things are run. And anyone who's in a nonprofit society may have met that person who wants to just go off and do whatever. But the executive and the board need to be recognized as being in powers. And then don't fight for services. People often think I'm crazy. Fight for citizenship. If you have citizenship and human rights, you'll get services. And if you only fight for services, you just get that next little half bite, or some new pilot, or, oh God, 24 people on safe supply. Oh, we only need 80,000. You know, it's been really awful to nibble at these things. And scale is important. Enabliness ensures success. So if a group gets too big, it can be a problem too, which is partly why you see the bigger groups break into smaller groups that focus on, you know, Indigenous issues, or focus on, you know what I mean, that commonality, and let those things go on. Women's groups are quite common too. And now we have a group that's doing child apprehensions. They're I don't know if they're called PAC, and it means something. Kith and kin, somewhere in there. So they're advocating to keep kids out of the foster care system, and showing up. Make sure you're there with a clipboard, and the child protection people are there, and you go, what's this all about? And you start taking notes. I'll tell you, the atmosphere changes very quickly. And anyway, I can't really read this. Something about, it's possible to create run drug user groups. Oh, if it's not possible, you can still, in some very sort of anal group, you know, you've got this job and you're doing something and you really want to start a user group and you don't think you're going to get permission. There's ways around it by creating a group, you know, do what you can. Find a little location. I don't know, you call it a support group, a fellowship, because, you know, the drug user groups are more like a fellowship than a service provision. We're not getting, you know, some drug users come to us and they're so disappointed because they think everyone there is going to get a job. And I'm like, no, we'll support you to get a job, because the jobs that are in harm reduction, we fought for those jobs. It used to be come back when you got 2 years clean. And then it was come back when you got 6 months clean. And then we just kept saying, you're killing people because they have to hide their drug use. And then they're found dead somewhere because they're afraid they're going to lose their job. I don't know, you guys must know what I'm talking about here. Anyway, so a lot of that work. So this is the Drug User Liberation Fund, and Jeremy should come and help me now. So this is another initiative where we're seeing drug users organize to create policy change. And and it's a compassion. I'm saying, what is the Drug User Liberation Front? What is the Compassion Club model of drug distribution? Is Section 7 of the Canadian Charter, which is life, liberty, and the security of person violated by the Controlled Drugs and Substances Act. So Section 7, as far as I know, is if they make a law in Canada and it violates your life, liberty, and security of the person, that law should be taken out. And we're trying to say that about the Controlled Drugs and Substances Act. And I believe the Canadian Association of People Who Use Drugs has a court case, but I don't know the update on how far they've gotten. And then section 15 is that every individual is equal with equal protection and benefit of the law without discrimination. And what's happened in previous precedent-setting cases is that a person with addiction, and that's the word they used in the case, is someone with a disability, and you cannot discriminate against them overtly. Anyway, so what would I get to here? There's a drug user liberation. There's the drug user liberation. That's Jeremy and Eris Nix. And so current models of medicalized safe supply is too high barrier for most people. Does everyone know what I'm talking about? That means you need to get diagnosed with substance use disorder. You need to go to a doctor and get a prescription. If you can even find a guy who'll prescribe, and then you got to do the whole prescription thing, and you got to show up at the right time. And you got to get your script at the right, like you fuck up anything. If you don't pick up your juice for 3 days, even with methadone, not even safe supply, that cuts you down to some ridiculous, you know, it's going to make you go to the street market that's toxic. I keep saying, is this a scheme to actually kill people? Because you think they've cleverly tuned it up so that it'll never stop being horrible. So the beauty of this model is you don't need to be diagnosed with as an addiction. Do you want to do it? Are you good at it? Yeah. And then just tell me if I make a mistake then. Okay. Delft Fulfillment Center and Compassion Club is in the downtown east side. This model, called the Delft Fulfillment Center and Compassion Club model, is a market and consumer protection intervention where street drugs are tested and then returned to the market in packaging that states the drug's contents. People who have already accessed safe supply from the Compassion Club model have experienced significant benefit. And so they're keeping track of that. And it's going to have a published paper, which is smart. And so here's the packaging that they were using. They're not using this anymore, but you know, it says heroin and then it tells you the contents, and cocaine, it tells you the contents, crystal meth, and it tells you the contents. So VANDU and Delft have applied for an exemption 56 from Canada. I guess it's Health Canada. Is it Health Canada? Yep. For a community-led compassion club. But they need the BC Ministry of Health to publicly support the creation of a community-led safe drug supply model. We have recently heard the exemption 56 was rejected for 2 reasons. Number 1, unacceptable risk to the health and safety of Canadians. Really? And number 2, no confirmed legal supply chain for heroin, cocaine, and crystal meth. So, oh God. You guys, unacceptable risk to the health and safety. Can you read this? This type of reason is unacceptable. Oh, I see. So they're saying they have this imagined harm to Canadians, and we know what the real harm to Canadians is, which is 21 Canadians a day are dying of overdose, I think it is. That this type of reason is unacceptable in the age of ever increasing toxicity of the illicit supply. With or without our program, drugs will be purchased from the illicit market by these participants. But in the Delft model, they will have an accurate understanding of the drugs they consume, so they are protected from the poison supply. The confirmed legal supply chain for compassion clubs, which is their other reason, that you got to buy it legally because they're buying it from the dark web. Some existing supply chains are largely inaccessible without an exemption. So you have to have an exemption 56 to use a legal supply, and they won't give them one because they're buying from the dark web. You want to see the bullshit here. Anyway, a coroner service death review panel report, safe supply is a broad concept that exists on a spectrum from a medicalized model treating people with a substance use disorder to a non-prescriber public health model. That's the one we want. That provides a safer supply of regulated drugs to people without substance use disorder. A medicalized model on its own is not sufficient to deliver safer supply to all who need it. So many people who die don't have substance use disorder, and they're just as dead. The exemption, they say they can't have the exemption because they buy from the dark web, and then they ensure the purity of it after they get it. They test it I don't know, 10 ways from Sunday. And then DELF cannot get pure drugs from pharmaceutical companies because they don't have an exemption. So you can't buy from Fair Price Pharma or anyone else who sells heroin and cocaine pharmaceutically unless you have the exemption, and they're refusing them to give them the exemption. So many people are dying that do not have substance use disorder. Of course, we're reinforcing that over and over so everyone gets what we mean, are unable to get prescription drugs as part of a drug treatment. Compassion Club model is their only hope. And so decriminalization puts people who use drugs at further risk. So Eris wrote this, and I don't know if I can read it. It's really dense. So decriminalization without regulation means that you're still getting toxic drugs, but the toxic drugs you have now, you're allowed to have 2.5 grams of drugs that will kill you. Isn't that soothing? Anyway, I think that's the reasoning, right? So you can't get anywhere with decrim. And I don't know if you've noticed this, but ever since decrim came in, I have never seen such an outpouring of hatred towards people who use drugs in social media. So it had the exact opposite effect that they thought it would have, which was, we were going, decrim, what difference is that going to make? And they said, oh, well, it's because there'll be less stigma and hatred towards drug users. The municipalities that are all trying to pass these bylaws, and just a kind of vicious narrative. All the Aaron, help me, what's his last name? The guy who makes the films. Aaron Gunn, yeah. So they've just gone completely nuts, and they don't have to supply any logic to what they're saying. It's just this sort of hysteria. Don't you feel scared when you see people outside? No, but you know what I mean? They're trying to whip this up. And ironically, the violence that occurs on the streets is lateral. You're not going to get shot unless you rip somebody off for drugs. And if you use, your common sense about walking down any street, anywhere, anytime, you would, if you saw someone like flailing or something, you might want to like move away or go back or cross it. Like, just use your logic. If your spidey sense is going off, like, deal with it. Because I'm sure all the data backs us up on that. It's the people who are the poorest, most marginalized people are the people who are suffering violence and being murdered. And of course, the murdered, oh God. So I think this is my last slide, right? So shut up. Dean thinks I'm awful. Anyway, so thanks, Dean, for the vote. So I don't know if you can see this, but when Dolph, this is Eris Nick, she has a great sense of humor. So Eris said, okay, when we go to this person, they send us to this person. When we go to that person, they send us to this person. And the bureaucracy is extremely dense. And she showed this to us once on a Dolph call. And I said, I got to get a copy of it, because this is just, so all the agencies, there's Canada, Health Canada, what is that? Public Health Services of Canada, the CIHR, come on, that's that, you guys know. What? Yeah, Canadian Institute, you guys are in there too, see? They'll shoot you over to, oh, health research, okay, CI, they're the ones who funded our injection support team, right? That's a federal source of research money, yeah. Okay, so anyway, it goes on and on. I just think it's shocking. And I tried to do this on a provincial level too, where I was saying, well, who's in charge? And each and every one of the health authorities has an entire addictions and mental health, or else they always call it mental health and substance use. They also call it mental health and addictions. And I just really think in the long run, we need to get away that the substance use stuff needs to get separated from mental health, because I always think it's, is it working? No. Anyway, I would say when you look at the spending, is it working? Oh, okay. So that's when you look at the budgets, and getting into any of these budgets is incredibly enlightening. It's the most powerful thing you can do with a bunch of people who are marginalized, is show them how the money is being spent to fix them, study them, or jail them, or whatever, that kind of category of them as a client. And it's just astounding. And what they really won't pay for is drug user groups. So my hypothesis is that drug user groups are going to be seen someday as important as the entire sort of sweeping of all of the 12-step groups, which could operate with no money at all. And if you look at the history of those groups, they started right when people coming out of it, the first members of AA would have been criminalized for their alcohol use. They started in 1930 something, and Prohibition didn't end until 1933. That's 13 years of criminalizing alcoholics who are being poisoned, jailed, murdered, like the whole 9 yards. And we often use this as a comparison, but I think we should take it a step further. It's not just that alcoholics wanted services. They wanted to be able to have a fellowship of people that they could talk to about what had happened to them. And it wasn't just, oh, I can't stop drinking. It was all the fucking hell of their lives of being, probably having their children taken away. Many of the things we see now, the hatred, the people only viewing them as morally defective. And so it was a big step up for them to get it viewed as a health issue. So anyway, that's, I think, any area of the world that doesn't have drug user groups is not going to be able to move forward, because the drug user groups are there till the bitter end. You know what I mean? Like what? Someone might arrest them. Oh, I know. Someone might force them into mandatory treatment. Like they're facing stuff that's unbearable, like take your children. Like these are terrible, terrible things to go through. So they have a lot of skin in the game in terms of the changes they'll make. And when everything else drops and we see a big political change and they stop funding certain service providers, you know, the drug user groups, they just keep in touch with each other because, and that's the other thing, is they've got tremendous networks. They all buy illegal drugs. That's a huge networking accomplishment to be able to score. And so even the people, they'll go, they do this to me, they go, well, you know, I was go, oh, OPS, well, OPS, you know, we got to get these things set up. And they go, well, you know, a lot of the people who die wouldn't have used an OPS anyway. They're found dead in their, you know, homes, and they're got jobs, and, you know, that whole thing, that little bait and switch thing. And I think, well, I'll tell you one thing I know, they all bought drugs from an illegal market, and that's your network that you want to use and not exclude, because that's how public health works. I'm pretty sure that you want to go with the social networks that you have and reduce, you know, spread information that saves lives, gather information that you need to know to plan for health stuff. Anyway, thank you very much.
And that was amazing to give us that historical perspective. I mean, and to think of needle exchange or needle distribution, which is a common part of our public health practice, and the critical role of drug user organizations. I'm hoping that we still have VANDU online.
Yeah, we're still there.
And I want to just invite Kevin, just before we close, I'm going to invite Kevin and also invite my colleagues from SOLID, who are both going to give some comments.
I just like to say, I worked with Ann for many times, over many times, my being on the board of VANDU for 12 years, and I just wrote this. So anyway, me being introduced to VANDU and me walking through these doors at VANDU are the best things I've ever done. Because I've met so many amazing people. One person that comes to mind is Ann Livingston. I don't know much. I didn't know much about harm reduction and all that stuff. And I listened to Ann speaking at conferences or coming to our board meetings and stuff like that. And she's long-winded, I know that. So I enjoyed listening to it because I was learning stuff all the time, and it brought me to this place. I'm the president now of VANDU, and yeah, it really helped me move forward in all the many fights of human rights, and is long-winded. I say that. I think that's a good thing. I can't read my writing. I've learned so much from her speaking. So for my new understanding, I got for this new understanding I got to thank Ann for that, for all the education and the stuff we do. It's a big part of it is listening to Ann. And now I know, as Bud Osborne said, vision is a better future we are fighting for and trying to make. We need vision to make sure we are going in the right direction, fighting for things and not going into fighting for better things and not going into traps or down dead ends. That's the system we will try to take with us. When I read this, I think of Ann Livingston. So thank you, Ann, for your many speeches and the education you gave me. Thanks.
Thank you so much, Kevin, and hello to everyone online and particularly those at VANDU. And I'm going to ask Mark Wilson from SOLID to give us some closing comments.
All right. Hey, folks. Mark from SOLID here. Ann just handed me a package of receipts for 15 grand that came out of her account, which I think is a really good example of the way that she does community organizing. Like, it's just giving and giving and giving and making things work regardless of what it takes. So I'd say one big quote I always hear from Ann that I always think about, makes me laugh a lot, is no good deed goes unpunished. And I think that is another example of her approach to community organizing. You do what you got to do, and you don't expect anything from it. Like, she's someone I know who's never gotten paid. Anytime she got paid, she gave it right back to the movement. So I just want to say it feels really refreshing to be here, celebrating a community organizer and the idea of community organizing, something that we all love and we're committed to, and a liberation movement that we've all been part of for a lot of years. And I think we've come together too many times in the last bunch of years with grief over losses. And I'm just thinking, the last time we were here was for Brent Donovan, the president of SOLID, who died a few years back. And good to be here in celebration and keep on going, everyone. It's a long fight. And you've been a good mentor for me too, last 10 years, showing me what to aspire towards and what it takes to really get the job done. So thanks for being here, everyone. It's great to be together. Yeah.